Well, hello. We all know how to measure weight by getting on a scale, and we know how to calculate BMI by comparing the height and the weight. But when should we not trust the weight and not trust the BMI? Well, the idea is that there's things out there like the cabbage soup diet and the grapefruit diet where people lost a lot of weight, but they lost mainly muscle and water. That's not healthy weight. So the weight is not the be-all end-all. The BMI is not the be-all end-all. The be-all end-all is what's inside the body and what is it doing. And how do we determine that? By analyzing the composition of a body, by doing a body composition analysis. So like I said, there's programs out there and people can lose weight, and that may not be healthy. And we want people to be able to lose weight in a healthy way. We know that BMI tells us if someone has obesity, pre-obesity, or if they're overweight or normal weight, but what about on the inside? That's where the body composition analysis comes into play. And so when patients come in here with their weight loss consult, they start off with a body composition analysis where they stand on a very fancy machine. It sends a bioelectrical impedance current through their body, and then it gives us a lot of information that's very helpful. So for starters, it does tell us the weight, and then it also tells us the BMI. But then the first thing it does afterwards is it tells us about the fat content. And the reason why fat is so important is because fat is where the health problems come with obesity. So the higher your fat percentage, the hungrier and more sluggish you're going to feel. So my goal is to help the fat percentage get down to a healthy range. And we talk about what healthy ranges are depending on if someone is male or female and depending on what their age is. We also talk about different tools that can help attack the fat to reduce it. Then we look at the water percentage, and the more water that's in the body, the healthier it is. A normal water percentage is between 40 and 60%. And so if someone has a higher fat percentage and a lower water percentage, we know that as the fat percentage decreases, the water percentage should increase into a healthier range. Then we look at someone's muscle mass, and there's no right or wrong number how much their muscle is, but muscle is going to help speed up metabolism, and that increased metabolism is going to help with weight loss. So what's important is as someone's losing weight, we want to maximize the fat loss and minimize the muscle loss. So that way they're losing the right thing. But again, there are programs where it's not being measured. People don't know what they're losing. They might be losing muscle and water, and that's not healthy. We really want to focus on the fat loss. And if we find that they're losing more muscle than we like, then we want to troubleshoot and try to figure out how to fix that. There's no way we can do that without doing a body composition analysis. Then we look at resting metabolism, which is how many calories somebody burns off in a day at rest. And it decreases with age and it decreases with menopause. So one of the things that we piggyback in a lot of our weight loss consults is what's going on with your hormones? Are you menopausal? Are you andropausal? What kind of role is that playing in your weight loss? So then afterwards, we talk about health and mortality. And again, the reason why I'm so passionate about treating obesity and overweight is because there are so many health complications as a result of it. It increases the risk of type 2 diabetes, high blood pressure, high cholesterol, heart disease, heart attacks, sleep apnea, kidney disease, all sorts of different kinds of cancers that can increase as a result of obesity. And so by treating the obesity, it can help lower the risk of these complications, which ultimately is going to help someone be healthier. So lastly, we talk about how much weight someone can lose. And we get to the last page of our body composition analysis, and it predicts how much weight someone could lose depending on what kind of program they're on, depending on what their caloric intake is. And then our goal is to design a program that's going to meet their needs. So that's when someone comes in for a weight loss consult. And then with follow-ups, we do an update to it. So how have things changed since the last visit? Again, putting you on a scale is going to tell us the weight, but it's not going to tell me what happens on the inside. And I've had patients who their weight didn't change, but they gained muscle and lost fat. They would have been discouraged if we couldn't tell them the change because a regular scale doesn't tell them that. But the body composition analysis does. It helps us to know what's going on the inside and making sure that someone is losing weight in a safe way. And if not, then we have the insight to know what kind of changes we need to make so they can lose weight the safe way. So my name's Dr. A. I'm a board certified obesity physician. I've been specializing in medical weight loss since 2009. And this is one of the tools that we use here in our office for our patients who come in for medical weight loss. I enhance the health and wellness of others to improve their quality of life, to help them look and feel their best on the inside and out. And that is truly my passion, to help people look and feel their best, because that's going to improve their quality of life. So if you are wanting to lose weight, or if you know someone who is wanting to lose weight, we would love to partner with you on this weight loss journey. And it is a journey. It's something that you're going to deal with in one way or another indefinitely. Sometimes things may be good, sometimes things may be not so good, but it is a journey. And so we're here to partner with you to help you achieve success, to help you sustain success. And so if you could benefit, or if you know someone else who could, please give us a call at 614-442-2600 or visit us online at www.prohealthservices.org. Again, this is Dr. A with Pro Health Services, and bye for now.